I'm Dr. Marie Morse. I'm the Director of Child Neurology and Pediatric Sleep Medicine at Geisinger General Children's Hospital. What does that mean? It means that I'm a board-certified neurologist with special qualifications in child neurology, as well as a fellowship-trained and board-certified sleep medicine specialist. What does that get you? It gets you someone who's able to take on anything that has to do with the brain. We even sometimes dabble in terms of what can be psychiatric or mental illnesses. My main focus, however, is always making sure that we're pushing out educational content that is streamlined and focused on sleep and utilizing that as a tool to achieve your best version of you, as well as for any of the patients that you're taking care of. Sleep is a critical element for every single person on Earth's best version of themselves during the day. For some reason in medicine, we have taken a stance of disconnecting what the daytime looks like from the night. But the reality is that repeatedly, evidence has demonstrated that sleep is the critical element to keeping all of the things together. What do I mean? Well, when we're looking at whether it's duration, quality, timing of sleep, or the quality of wakefulness, what we're recognizing is that they have all the same features, that when they are being disrupted, we are seeing worse outcomes, worse physical, mental, emotional wellness altogether. In fact, in January of 2024, there was a new publication that has helped in fulfilling more knowledge by understanding that our focus on just sleep duration probably is lacking. Even though the most recent Gallup polls have demonstrated that 1 in 2 adults, actually the statistics are even more, it was about 60%, are getting insufficient sleep, what we now have learned is that by examining the UK Biobank's data, which had millions of data points, sleep regularity may actually be the factor that is even more meaningful for achieving that optimal health. What do I mean by that? I mean the fact that it had demonstrated that irregular sleep, having wide swings in the time we're going to bed and the time we're waking up, and even more so, fragmentation across the day, have a higher risk association with all-cause morbidity and mortality than insufficient sleep alone. So when we're thinking about sleep, it's not thinking about the thing that in medicine we have been perpetuating as getting away with less of in order to do more in the day. What we should be leaning in on is utilizing sleep in terms of the quality, duration, and timing as the optimal tool that was well designed in our bodies to be able to achieve the best version of us every single day. What is so exciting is that we are now on the cutting edge of sleep. When you think about the field of sleep, it is a young field, only first established in the 1970s. We are now in 2024, and what we have seen is a field that has grown from focusing on things like sleep disorder, breathing, and even insomnia to now really embracing rare sleep disorders like narcolepsy and idiopathic hypersomnia. With that stated, we now are having a more fulfilling understanding of the pathophysiology that is driving some of these things, such as orexin deficiencies in narcolepsy type 1. What has that resulted in? It now has resulted in the new development of novel drugs that are orexin agonists. In addition to that, we now are seeing that not only are they in phase 1, phase 2, but we have our first studies entering into phase 3 of utilizing these medications in central disorders of hypersomnolence, like narcolepsy type 1, type 2, and even idiopathic hypersomnia. This is really transformative because we now are treating to the cause versus just masking the symptoms that a person is experiencing. We want to further some of these advancements. Well, you know what's exciting is we've seen that the world has been taken by storm by GLP-1 agonists. When we look at these, we really are thinking about them as being weight loss drugs, and they've been really kind of the miracle cure for many people who've been struggling with weight management. And we recognize that in the United States, that is at least 75% of adults who are overweight to obese. And of those, 50% have stated in the last year they've had weight loss attempts. Now, we want to couple that with what we know weight can contribute to. It's sleep disorder breathing, obstructive sleep apnea. And historically, we've limited ourselves with just utilizations of CPAPs or BiPAP therapy. The reality is that where we are currently is not only have we been able to move the needle by utilizing mandibular advancement devices, utilizing surgical therapies, whether it's purely ENT surgeries that are modifying our airways, but also things like hypoglossal nerve stimulators that are improving our upper airway tone, but now also utilizing GLP-1 GIP agonists that have phase 3 data that are demonstrating substantial benefit both with and without CPAP in improving the apnea-hypopnea index and improving the quality of life of individuals. This is not only being able to provide weight loss, but the thing that you may be lacking in recognizing is that GLP-1 has, by surprise, both direct and indirect relationships with, yes, the neurotransmitter orexin. And what we know about orexin is that it's not only weight promoting, but it also may be a facilitator in improving the quality of sleep at night. And so what we're now seeing is a transformation to not only treating the symptoms, but again, treating at the cause and helping people to achieve the quality of day and night that they truly deserve. Every year, sleep is the biggest sleep conference in the world. It's funny to think about that in Houston, Texas, in just a few days, that we're going to be seeing a turnout that is global in capacity and really transformative in terms of what do we do on a day-to-day in terms of clinical delivery of care, but also the research fundamentals that are driving future innovation. Some of the things that I'm most excited about include the Sleep Research Society's roundtables, where we really are discussing in detail some specific disease processes. I'm very fortunate to be able to be chairing one of those, where we're looking at idiopathic hypersomnia and narcolepsy and really digging into what does the current landscape and the future have in store. We also are going to start seeing some of the data rolling out, as well as study designs that are planning to be utilized for the newest class of drugs that are going to be coming to market, and that's our orexin agonists. We know that Takeda is going to be hitting the floors with being able to show some of their abstracts and posters, as well as having some of their oral presentations around their newest phase 2 data and seeing what the future looks like with the phase 3 very close in sight. Other companies, because it's a race to the finish, are also going to be presenting on whether it's their study design or some of their early phase data around their orexin agonists. For me, I also have significant interest and excitement around how we're continuing to see the emergence and evolution of sleep apnea management. We have gone from thinking about just PAP therapies as that being the standard of care to now seeing emergent data that has demonstrated great adherence and improvement in obstructive sleep apnea using things like mandibular advancement devices. We also have seen things like hypoglossal nerve stimulator be able to be utilized. We now are seeing an emerging spectrum of medications. We have our GLP-1 GIP agonists, which are injectables that have now phase 3 data to demonstrate benefit. However, we're also seeing our first oral therapies with a combination of atomoxetine and oxybutynin, which are also demonstrating significant improvement and advancement in the phase of study to potentially be the first oral medication available for the treatment of sleep disorder breathing. The reality is that we've moved away from purely thinking about a restricted scope of disease processes that we potentially can treat to now really acknowledging that the International Classification of Sleep Disorders Edition 3 text revision, and yes, that's a mouthful, is really now acknowledging all 70 of those different disorders that exist within that book. We now are also identifying that we are having more tools in our tool belt, not only for this therapeutic landscape, but really now starting also to dig into what are the better diagnostics that we can consider. Historically, it's been in-lab polysomnography. We then have seen home sleep apnea testing being utilized. But what is exciting is the emerging data and research around other home testing, remote patient monitoring testing, as well as machine learning and artificial intelligence that isn't going to replace our jobs, but actually augment what we're able to recognize that our eyes may not be able to see. The reality is that we are just at the beginning, at the cusp of really emerging in a field where it is transdisciplinary and the research is only demonstrating the impact and the critical relevance across all disease processes, and being able to use this combination of different diagnostic strategies and therapeutic intervention is only going to allow us to be able to reach more patients so they can have their best nights for even better days.